With the skeletal system, your 7 avenues of access, you've got 2 ears, 2 eyes, 2 nostrils and a mouth. Everything that goes into those avenues of access has an effect on the brain. Everything we hear or have ever heard is monitored in the brain. Everything we see, everything we smell tells us a story. Everything that we eat or drink or anything else that goes in by the mouth has an effect on the brain.
Have you ever considered whether the daily pill you take could be influencing your brain health? Picture this. You've been on a medication for years, believing it's benefiting you, only to later discover it might actually be harming your cognitive function. Today we're diving into a crucial yet often overlooked topic: medications that may contribute to dementia. Stick with us as we uncover 10 widely used medications associated with cognitive decline. Gaining insight into these risks could transform how you approach your health. And don't miss out. Medication number 8 is the most surprising and commonly used of them all. Before we get started, I'd love to hear from you. Where are you watching from? Drop a comment below and feel free to ask any questions along the way. Now, let's get right into it. 1. Benzodiazepines. Benzodiazepines, including Xanax and Valium, are widely prescribed to treat anxiety, insomnia and stress conditions. These drugs enhance the effects of gamma-aminobutyric acid, GABA, a neurotransmitter that calms the nervous system. While they provide short-term relief, extended use can pose serious cognitive risks. Research has shown that long-term benzodiazepine use may interfere with normal brain function, leading to memory impairment and cognitive decline. For instance, a French study spanning 15 years and involving over 1,000 elderly individuals found that regular benzodiazepine users had a 60% greater risk of developing dementia than those who did not use these medications. The potential for physical and psychological dependence further complicates the situation, making discontinuation difficult without medical guidance. If you or someone you know relies on benzodiazepines, discussing the risks with a healthcare provider is essential. Alternative treatments such as cognitive behavioural therapy, CBT, can effectively manage anxiety and insomnia without increasing dementia risk. Transitioning to these options requires careful planning to avoid withdrawal symptoms and ensure treatment success. Given these findings, it is crucial for both patients and healthcare providers to re-evaluate the necessity of benzodiazepines, particularly in older adults. Exploring alternative therapies can help maintain cognitive health while effectively managing anxiety and sleep disorders. Always consult your healthcare provider before making any medication changes. Type brain health if you're committed to protecting your memory and cognitive function. 2. Anticholinergics. Anticholinergic drugs, including atropine, hyoscyamine, meclizine and scopolamine, are commonly prescribed for allergies, urinary incontinence and Parkinson's disease. They work by blocking acetylcholine, a neurotransmitter vital for memory and learning. While effective, growing evidence suggests they may negatively impact cognitive function. Studies have demonstrated that prolonged anticholinergic use can lead to cognitive decline, especially in older adults. Acetylcholine is crucial for brain processes like memory formation and retention. Blocking its function can cause memory problems and elevate dementia risk. A University of Washington study that followed more than 3,400 adults over 7 years revealed that those who frequently used anticholinergics faced a 54% higher risk of developing dementia. Lisa, a 67-year-old retired teacher, had been taking antihistamines and bladder control medications for years, unaware of their cognitive effects. Initially, she brushed off her forgetfulness as normal aging, but over time she began missing appointments, struggling to recall conversations, and feeling mentally foggy. After watching an awareness video about medication cognitive decline, she spoke to her doctor and discovered that her anticholinergic medication could be a contributing factor. With her doctor's guidance, Lisa transitioned to alternative treatments and made lifestyle changes. Within months, she noticed a significant improvement in her memory and focus. Lisa now advocates for others to review their medications regularly and be aware of potential risks. Many people may not realise that their everyday allergy medication could be contributing to cognitive decline. If you or someone you know takes anticholinergics regularly, it's important to discuss alternatives with a healthcare professional. In some cases, nasal corticosteroids may be a safer option for allergy relief without the cognitive drawbacks. Have you or a loved one experienced memory issues while taking medication? Type "stay aware" to spread awareness. 3. Opioid painkillers. Opioid medications, including morphine and oxycodone, are prescribed to manage severe pain, especially post-surgery or for chronic conditions. These drugs work by binding to opioid receptors in the brain and spinal cord to provide pain relief. However, their risks extend beyond addiction and dependence. Research suggests that prolonged opioid use can alter brain structure and function. Studies indicate a reduction in grey matter volume in areas responsible for memory and decision making, which can contribute to cognitive issues and increase dementia risk over time. The sedative effects of opioids further complicate matters, leading to drowsiness and concentration difficulties. A study published in the Annals of Internal Medicine linked long-term opioid use to an increased likelihood of developing dementia. John, a 58-year-old construction worker, was prescribed opioids for chronic back pain following an injury. At first, the medication helped him manage the pain, but as time passed, he found himself struggling with concentration, experiencing confusion, and even forgetting common words mid-conversation. Concerned, John visited a neurologist who confirmed that prolonged opioid use can affect brain function. With the help of his healthcare team, he gradually transitioned to non-opioid pain management strategies, including physical therapy and acupuncture. Within a year, he reported feeling more alert, mentally sharp, and in better control of his cognitive health. If you rely on opioids for pain management, it's vital to maintain an open dialogue with your healthcare provider. Discuss potential cognitive risks and explore alternative pain management strategies such as non-opioid medications, physical therapy, acupuncture, or mindfulness-based approaches. If opioid use is necessary, work with your doctor to ensure the lowest effective dose is used for the shortest duration possible. Regular monitoring can help mitigate side effects while maintaining pain relief and cognitive health. If you believe more people should know about these risks, type "knowledge is power" in the comments. 4. Tricyclic antidepressants, TCAs. Tricyclic antidepressants, such as amitriptyline and nortriptyline, are primarily prescribed for depression, but are also used to treat anxiety disorders, chronic pain, and insomnia. These medications function by increasing serotonin and norepinephrine levels in the brain, improving mood and reducing depressive symptoms. However, TCAs carry cognitive risks, particularly for older adults. Their anticholinergic properties can interfere with acetylcholine function, potentially leading to memory impairment and an elevated risk of dementia. Research published in JAMA Internal Medicine found that long-term use of anticholinergic medications, including TCAs, is linked to cognitive decline. For those using TCAs, regular check-ins with a healthcare provider are crucial. Discussing any cognitive changes can lead to dosage adjustments or alternative treatments, such as cognitive behavioural therapy or lifestyle modifications, which may effectively manage depression while protecting brain health. 5. Antipsychotics. Antipsychotics like haloperidol and risperidone are prescribed for severe mental health conditions such as schizophrenia and bipolar disorder. They work by altering neurotransmitter activity in the brain to control symptoms like hallucinations and mood swings. While effective, long-term use of antipsychotics has been associated with cognitive decline. Studies have found that these medications may contribute to brain structure changes, leading to memory loss and impaired thinking. A study in the British Medical Journal reported that elderly patients on prolonged antipsychotic therapy experienced accelerated cognitive decline. Furthermore, these medications can cause sedation, tremors, weight gain, and an increased risk of diabetes, complicating both mental and physical health. Regular medical monitoring is crucial to manage these side effects and adjust dosages accordingly. 6. H2 receptor blockers. H2 receptor blockers such as ranitidine, famotidine, cimetidine and nizatidine are commonly used to manage conditions like acid reflux, ulcers and GERD by reducing stomach acid production. While they are generally considered safe, some researchers linked long-term use to an increased risk of cognitive impairment, particularly in older adults. A few studies suggest that prolonged use of H2 blockers could contribute to memory loss and an elevated risk of dementia. However, the evidence is not yet conclusive and more research is needed to establish a clear connection. If you rely on H2 blockers for acid conditions, it's important to discuss potential cognitive risks with your healthcare provider and consider alternative treatments such as dietary modifications and lifestyle changes, which can help manage acid reflux symptoms more naturally. Anti-epileptic drugs. Anti-epileptic drugs, AEDs, such as phenytoin and valproic acid, are crucial for managing seizures in individuals with epilepsy. They work by stabilising electrical activity in the brain, preventing seizures and improving the patient's quality of life. However, their long-term use has raised concerns about potential cognitive side effects. Research suggests that prolonged use of AEDs can impair memory, attention and processing speed. These drugs may interfere with neurotransmitter function, which is essential for efficient communication between brain cells. A study published in Neurology found that long-term use of certain AEDs was linked to an increased risk of dementia, particularly in older individuals. If you are taking anti-epileptic medications, discussing potential cognitive risks with your healthcare provider is crucial. In some cases, alternative treatments or dosage adjustments can help mitigate cognitive side effects while maintaining seizure control. Which of these medications surprised you the most? Type the number that shocked you the most. 7. Statins.
When I was 19, 20, I worked as a psychiatric nurse, and the first ward I worked in was an accident victim ward. Why have we got accident victims in a psych hospital? Because the damage was done to the brain. And once the brain goes, really the life almost isn't worth living, because they were just robots. They were like zombies because brain function had gone. We've got to look after this brain. God did a good job in giving us a protective structure there.
Statins, including atorvastatin, simvastatin and rosuvastatin, are widely prescribed to lower cholesterol levels and reduce the risk of heart disease. These medications work by inhibiting HMG-CoA reductase, an enzyme responsible for cholesterol production in the liver. While their cardiovascular benefits are well established, some concerns have emerged regarding their potential impact on cognitive health. Some individuals report experiencing mild memory problems while on statins, though large-scale studies have produced mixed results. A study published in the Journal of the American College of Cardiology found that while some patients experienced minor cognitive changes, these effects were often temporary and reversible. The overall cardiovascular benefits of statins typically outweigh these potential side effects. However, if you notice memory issues while taking statins, discussing alternative cholesterol-lowering strategies with your healthcare provider is advisable. If you've ever taken any of these medications, type health first in the comments. Proton pump inhibitors. Proton pump inhibitors, such as omeprazole and esomeprazole, are frequently used to treat acid reflux and ulcers by reducing stomach acid production. While they can provide significant relief from digestive discomfort, Emerging research suggests that long-term PPI use may pose risks to brain health. Studies indicate that extended use of PPIs may be associated with cognitive decline and an increased risk of dementia. One possible reason is that PPIs can interfere with the absorption of essential nutrients such as vitamin B12 and magnesium, both of which are crucial for brain function. A study published in the Journal of the American Geriatric Society found that individuals who regularly used PPIs had a higher risk of developing dementia compared to non-users. If you rely on PPIs for managing acid conditions, consider discussing potential risks with your doctor and exploring lifestyle modifications that may help reduce dependence on these medications. Maria, a 72-year-old grandmother, had been using PPIs for over a decade to manage her acid reflux. She never suspected they could affect her memory, until her daughter noticed she was frequently repeating herself and struggling with simple tasks. A routine checkup revealed that her vitamin B12 levels were dangerously low, a known side effect of long-term PPI use that can impact cognitive function. With medical guidance, Maria adjusted her diet, took supplements, and reduced her reliance on PPIs by incorporating lifestyle changes. Over time, she felt sharper, more energetic, and relieved to regain mental clarity. 8. Hormonal contraceptives. Hormonal contraceptives, particularly those containing estrogen and progesterone, are commonly used for birth control and managing conditions such as menstrual irregularities and acne. While they provide effective reproductive control, some studies suggest that prolonged use may have subtle effects on cognitive function. These contraceptives alter hormone levels in the body, which can influence brain function. Estrogen and progesterone play essential roles in memory, learning, and mood regulation. Some researchers found a potential link between long-term hormonal contraceptive use and mild cognitive decline, though findings remain inconclusive. A study published in the Journal of Women's Health suggested that women who used hormonal contraceptives for many years experienced slight changes in cognitive processing compared to those who did not. While the potential cognitive effects of hormonal contraceptives are still being studied, if you have concerns, discussing alternative birth control options with your healthcare provider may be beneficial. They can help assess the risks and benefits of different methods to find the best fit for your needs. If you're planning to talk to your doctor about your medications, type "taking charge" in the comments. 9. Beta blockers. Beta blockers such as metoprolol, propranolol and atenolol are widely prescribed for high blood pressure, heart disease and anxiety. They work by reducing the effects of adrenaline, slowing heart rate and lowering blood pressure. While effective for cardiovascular health, concerns have emerged regarding the impact on cognitive function. Some studies suggest that beta blockers may contribute to brain fog, memory issues and confusion, particularly in older adults. This is because they can reduce blood flow to the brain, potentially impairing cognitive processes. A study published in the Journal of the American Geriatric Society found that long-term beta blocker use was linked to an increased risk of cognitive decline and dementia in elderly patients. If you or a loved one is using beta blockers and experiencing cognitive difficulties, speak with a healthcare provider about possible alternatives or dose adjustments. Lifestyle changes, such as exercise and dietary modifications, may help manage blood pressure without cognitive side effects. 10. Sleep aids. This is eat of hypnotics. Common sleep aids, including zolpidem, Ambien, ezapicolone, Lunesta, and diphenhydramine Benadryl, Unisom, are frequently used to treat insomnia. These medications work by depressing the central nervous system, helping people fall asleep faster. However, studies show they may have unintended effects on memory, attention, and long-term cognitive health. Research indicates that prolonged use of these sedatives can lead to increased dementia risk. A study published in JAMA, Internal Medicine, found that people who used sleep aids regularly had a higher likelihood of developing Alzheimer's disease compared to non-users. The sedative effects can cause next-day drowsiness, confusion and impaired memory, particularly in older adults. To improve sleep quality without cognitive risks, consider alternatives such as cognitive behavioural therapy for insomnia, CBTI, relaxation techniques, melatonin, or lifestyle adjustments. If you rely on sleep aids, consult a doctor about safer long-term solutions. Want to see more content like this? Type more info and let us know what health topics interest you. Thank you for tuning in. Always consult with a healthcare professional regarding any medications you take. Prioritise your brain health by staying informed and making educated decisions about your treatments. Don't forget to subscribe for more valuable health insights. Stay informed, stay healthy.